Friends, there is one symptom of epilepsy that gets missed very often. A patient comes to your OPD and tells, "Doctor, there is something abnormal rising up from my stomach." Usually, it is dismissed as gas or some kind of acidity or reflux disease, or maybe some anxiety. And that is fair enough because usually most of the stomach symptoms originate from stomach. However, if these symptoms arise suddenly and are brief, lasting for a few seconds, may be associated with some kind of chewing movements of the lips or some kind of confusion, then it can be a symptom of epilepsy. So at this point of time, stop and think about the symptoms, whether they are occurring repetitively at some kind of intervals, maybe once in a month or once in a few months. And then you have to go back and ask to the patient if there is history of epilepsy, bigger seizures, or maybe a history of febrile seizure in childhood, because this is very common in temporal lobe epilepsy. It is no longer patient's imagination. It might be the first symptom of temporal lobe epilepsy, which is a focal seizure arising from one part of the brain and causing these symptoms.